Hey guys, Tony Maritato here, licensed physical therapist, and I want to talk a little bit about the anatomy of the shoulder so that whether you're going to see a surgeon for a rotator cuff repair or you just have shoulder pain associated with an impingement syndrome or bursitis or tendinopathy, it always helps if you understand like what the structures are, what they do, how they function, and where your pain might be coming from. So let's take a look at this. I'm going to move that mic over. Basically, when we talk about the bony anatomy of the shoulder, it's pretty simple. There's the upper arm bone. This is called the humerus. There's the collarbone that runs across the front of the chest and neck. That's the clavicle. And then behind you, that is your scapula. That's a triangular bone that floats over the rib cage. So your shoulder effectively has three bony structures: the humerus, the clavicle, the scapula. Those guys kind of start at the base of the neck, they come out to a point. And so when you're moving your arm, whether you're moving with pain or without pain, those three bones have to move around. Now you've probably heard the term rotator cuff. That's a combination of four primary muscles that are small muscles that surround the head of the humerus, the bone that's the upper arm bone. And what they really do is they can kind of control that humerus. So the way I explain it to my patients in the clinic is if you think of the top of the clavicle and the shoulder blades creating kind of a bony roof, and then below that bony roof you have the top of your humerus, there's a little bit of space in here. There's a subacromial bursa, which is a fluid-filled sac that helps with a little bit of cushioning and a little bit of lubrication. So what happens is when I go to move my arm, what should happen is those rotator cuff muscles attach into the head of the humerus. They either pull it down as the other end of the humerus goes up, they control the rotation. They really try to keep that humerus kind of centered within the joint so that your shoulder has lots of different ranges of motion. From flexion to abduction to internal external rotation, all of those components. The shoulder is one of the most mobile joints in the body, and so you need that rotator cuff to really kind of hold and stabilize the joint as those bones are moving through. So we've got the bony structures, we've got the musculature. Now, I mentioned the four rotator cuff muscles and their associated tendons, but don't forget, we also have the bigger muscles. So the biceps, it's a two-headed muscle. One of the bicep tendons comes across in front of the shoulder. When a patient tells me they get pain when they're like reaching in front of them, trying to get a gallon of milk out of the back of the fridge, that's usually associated with a biceps tendinopathy or tendinitis. The short head of the bicep kind of comes into the armpit and attaches to a bump on the bone of the scapula that comes in the front. Then of course we have our pectoral muscle. Pectoralis major is a big muscle that runs across the front of the chest. We've got this big muscle on the back of the neck, which is part of the trapezius muscle. There's a skinny long muscle that goes from the base of the skull, kind of behind the ear, down to the top of the shoulder blade. That's called levator scapulae. And when you press on any of those spots back there and you kind of move the arm around and it's tender, it's usually a little bit sensitive to pressure. It's that muscle that's sensitive, and sometimes that muscle is tight and guarded. You know, if my shoulder's in pain, I tend to hike my shoulder. So all of these components kind of work together. But don't forget, we've talked about muscles, we've talked about associated tendons, we've talked about bones. You've got ligaments. So there are ligaments that hold the clavicle and the scapula together. There are ligaments that hold the sternum, which is the chest plate, and the clavicle together in here at the base of the neck. There are ligaments all throughout the shoulder musculature. Ligaments connect bone to bone. Tendons connect muscle to bone. But then you have your circulatory system. So there's arteries and veins. There's capillaries, which are all the small blood vessels that bring blood out to the extremities and help exchange oxygen and nutrients. There's also lymphatic system. Lymphatic system is kind of like the venous system. It brings fluid back from the extremities. It brings larger proteins and waste products back into the system to be processed by the liver. Certainly, everybody understands that there are plenty of nerve endings. So the cervical, which is the neck, plexus, those are the nerves that come out through the neck. Some of them cross in front of the shoulder, through the shoulder, behind the shoulder. Sometimes when people are experiencing tingling, numbness, you can associate it with a specific, what we call dermatomal pattern. So if I know that there's a certain dermatome associated with a nerve root in the neck, I can usually identify like the pinky and ring finger, the thumb and index finger. These are associated with specific dermatomal patterns, which you can look up the chart and you can see which nerve root is involved with which general area of the arm and upper extremity. So there's a lot of stuff going on. So when a patient comes to a physical therapist, to an orthopedic surgeon, the patient says, well, doc, I've got shoulder pain. We really want to dig in before we do imaging, before we do anything else. We want to really dig in and help to understand what are the structures involved, where might that pain be coming from. We haven't even talked about referred pain, which is a situation where the pain might be originating in an area away from the shoulder, most commonly the neck. But the idea is that there are lots and lots of reasons for someone to experience pain. Pain is a highly subjective experience. It's something that changes with many factors, not just tissue damage. You can have tissue damage without pain. You can have tissue damage with pain, and kind of everything in between. So guys, before you go to your next physical therapy appointment, doctor's appointment, really take some time, listen to the words that I've used, go back and watch this video, and do a little Google research so that you can look at the structures that make up the shoulder, the base of the neck, the thoracic spine, and really start to identify when your therapist says, where is your pain? We want to try to pinpoint it as closely as we can, to the point where I usually will ask, with one single finger, point to the pain. And then we want to know, of course, does it hurt when you lift? Does it hurt when you go down, reach out? Like, what are the actions or positions that cause pain? So guys, I hope this little tutorial was helpful for you. If you haven't already, please take a minute, subscribe to the channel, and ask your questions down below, because my goal for this YouTube channel is to really help bring education to the population. I see patients every day in my clinic who really, once they understand what's going on, they feel so much more empowered and in control. I'll catch you guys on the next video.